The Health Odyssey, a journey through community and One Health. It was a warm, sunny day in the vibrant town of Efriye, where a diverse group of university students from the School of Public Health had gathered for a special field trip. Their mission to explore the true meaning of health, not just as an individual state, but as a community treasure. The essence of health. As the group settled under the shade of a large wawa tree in the village square, Professor Mensah, their seasoned mentor, began. Health is more than the absence of illness. It's a dynamic state of physical, mental, social, spiritual, and even economic well being. According to the World Health Organization, health is a complete state of well being, not merely the absence of diseases or infirmity. It exists on a continuum ranging from ill health to full well being. A curious student, Amma, raised their hand. So, if someone feels happy and energetic, even if they have a minor illness, can we still consider them healthy? Professor Mensah replied, exactly, Amma. Health isn't black or white. It's about how well we function in our everyday lives, despite our challenges. Health in the context of community. After the discussion, the student visited the local community center. Here, Nana Kofi, the community leader, explained. A community is a group of people living together in the same locality with common culture, norms, and values. When we talk about community health, we refer to the overall health profile of these people. This includes things like the availability of clean water, proper sanitation, good healthcare facilities, and even social factors like education and employment opportunities. Nana Kofi pointed to the modest clinic in the distance. Our health depends on our environment, our local services, and how we support one another. That's why community health is not just about individual health, it's about our collective well being. Embracing One Health policy. Later that afternoon, the group gathered in a workshop at the community hall where Dr. Ifwa, a specialist in integrated health system, introduced a concept of One Health policy. Dr. Ifwa, One Health is a collaborative, multisectoral, and transdisciplinary approach that recognizes the interdependence of human, animal, and environmental health. It's about understanding that our well being is linked with the health of domestic animals, wildlife, and the ecosystem we share. She elaborated on key components. 1. Human health. Our physical, mental, and social well being is influenced by our living conditions, healthcare access, and local environment. 2. Animal health. Zoonotic diseases like rabies, influenza, or even COVID-19 shows that the health of animals can directly affect us. 3. Environmental health. Clean air, water, and a balanced ecosystem are crucial for maintaining health. Dr. Ifwa, this integrated approach requires collaboration among the Ministry of Health, Veterinary Services, and the Environmental Protection Agency, among others. Only by working together can we achieve optimal health outcomes for all. Building the community health profile. Back under the um, Wawa tree, Professor Mensah gathered the students again and explained how a community's health is assessed. He describes the community profile as a detailed picture of geographical location where the people live and the environment they live in, social and political arrangement, the community's governance and social systems, economic activities, farming, commerce, and other economic engagements that influence living standards, health facilities and infrastructure from clinics to water and electricity supply, health indicators, metrics like infant mortality rate, maternal mortality rate, average life expectancy, and more. Professor Mensah said these elements help us understand the burden of diseases and the overall health status of a community or even a nation. They guide us in planning and implementing health interventions at the primary, secondary, and tertiary levels. A student named Kojo noted, so if we see a high maternal mortality rate, it tells us there might be issues with our local health facilities, or perhaps even with social and economic factors. Professor Mensah replied, precisely, Kojo, and that's why we need to look at health as a whole, combining the individual, community, and the broader health system. The determinants and dimensions of health. The conversation then turned to the factors that shape health. Professor Mensah explained the key determinants of health: physical and biological factors, genetics, physical environment, and lifestyle habits, economic factors such as income, employment, and access to financial resources, social factors like education, family, community support, and cultural practices, psychological factors like mental health, stress levels, and overall emotional well being, religious and political factors like beliefs, policies, and governance that can lead, or let's say, like, that can affect health service and community behavior. He continued, Professor Mensah, health can be seen in two dimensions. The positive dimension is well being and empowerment, while the negative dimension involves diagnosis, discomfort, or illness. These dimensions are both objective, like measurable symptoms, and subjective based on personal experience. He drew a simple quadrant on the board. 1. High well being despite illness. 2. Low illness and high well being. 3. High illness and low well being. 4. Low illness but low well being. Professor Mensah said this helped us see that health is not just about being disease free, it's about overall quality of life. As the day came to a close, the students reflected on their journey. They had traversed from understanding individual health and exploring the intricate web that connects human, animal, and environmental well being. They had learned that health is a comprehensive, dynamic state that goes beyond just the absence of disease. Community health is shaped by a variety of social, economic, and environmental factors. One health policy is essential for addressing modern health challenges through collaboration. Key determinants, from physical and biological to social and political, play a vital role in the overall health and community of nations. With heart and mind enriched, the students promise to carry the holistic understanding of health into their future work, determined to improve the well being of every community they touched. And so, in the vibrant town of Efree, the seeds of comprehensive health understanding were sown, a journey that would continue to inspire change and promote the well being of individuals, communities, and nations alike. Thank you. You are listening to Zerit Podcast.